What's going on, guys? Welcome to the circus. So, this is episode 2, is what I would call it, of the Waiting on the New Microphone Chronicles. So, I haven't released yet, but I put out yesterday a Tucker Carlson monologue that struck me as extremely important that most people haven't gone over or really seen, really. So, I'm going to release that tonight, and then at the same time tonight, or maybe tomorrow, I'm going to release this episode. We're going to talk about Governor Cuomo. For anybody who's been keeping track of my channel for any amount of time, you'll know that the nursing home thing was something that really bothered me, and it's something that I went pretty hard on pretty early, maybe too early. But the story around Cuomo is starting to kind of take shape. And so I wanted to touch on the latest developments, but I also wanted to take you back to a video I made about this whole situation that I think it maybe got like 11 likes or something like that, maybe just a few views. It's a long time ago. It was 7 months ago that I did this particular episode, and it was even longer, further back, that I first broke the story about what was going on in the nursing homes and what states. But this particular episode that I made, that was 7 months ago, it is specifically about Cuomo, and it's specifically about some of the claims that Cuomo is now making to try to obfuscate his own complicity in this situation. So we're going to clear some of those up. All right? So let's get into it. So the latest thing is that his secretary, the secretary of the governor, came out and basically admitted that they had been hiding the CV statistics that we as a channel have gone really deep into and been looking at for months and months now. We have an on-air admission by somebody in the senior government that they were hiding the numbers actively. And here's the story, because for the beginning of this is just all reaction from Republican people in the state of New York, and we don't really care about that, right? It's just a bunch of political posturing. We're looking at this because somebody needs to go to jail for this. And it also is something that opens up the rest of the conspiracy around this situation. All right. The comments come after the Post revealed that Secretary to the Governor, Melissa DeRosa, said during a video conference call with state Democratic leaders that the administration had rebuffed a legislative request for the tally in August because, quote, right around the same time, then President Donald Trump turns this into a giant political football, according to an audio recording obtained by the Post. Quote, he starts tweeting that we killed everyone in nursing homes, DeRosa said. He starts going after New Jersey Governor Phil Murphy, starts going after Gavin Newsom, starts going after Gretchen Whitmer. In addition to attacking Cuomo's fellow Democratic governors, she said Trump directs the Department of Justice to do an investigation into us. What kind of horrible person Trump must be to demand an investigation into why you morons moved CV patients into older folks' homes. Quote, and basically we froze, DeRosa said to the lawmakers, because then we were in a position where we weren't sure if what we were going to give the Department of Justice or what we give to you guys, what we start saying was going to be used against us while we weren't sure if there was going to be an investigation. So basically, we didn't want to give out any of the data points because we didn't want it to be used against us, and we didn't know for sure that they were going to do a DOJ investigation because we were running out the clock on the Trump presidency at the same time. State Attorney General Letitia James, who you'll remember from the insane attempts at prosecuting Trump, and Amazon and all kinds of insane stuff from Miss Letitia James, but whatever. State Attorney General Letitia James recently announced in a damning 76-page report that the Empire State's nursing home death toll from the CV may be more than 50% higher than officials have claimed because of Cuomo's administration had not revealed how many of those residents died in hospitals. So because of Governor Cuomo and his administration's intentional obfuscation of the numbers, it is going to be more than 50% higher, the number of total deaths that came out of nursing homes. The bombshell findings could push the DOH tally of 8,711 deaths to more than 13,000, based on a survey of 62 nursing homes that found the state undercounted the facilities there by an average of 56%. New York State Republican Party Chairman Nick Langworthy thundered, "The second most powerful person in state government and top aide to Governor Cuomo admitted on video to the premeditated and willful violation of state laws and what clearly amounts to federal obstruction of justice. Andrew Cuomo has abused his power and destroyed the trust placed in the office of governor. Prosecution and impeachment discussions must begin right away." Of course. But here's where the story gets even more interesting, is that now you are starting to have Democrats in the state jump on board finally. Democrats, including public advocate Eumaine Williams, also assailed the governor, tweeting, "To continual defenders of at New York Governor Cuomo, how is this okay? How is this not hashtag Trump-like?" And who cares about the reference to Trump? Just understand that when you have people from both sides of the aisle that are starting to look at this, you're looking at a possibility of further prosecution. And when forced into admission, the most you get is a "sorry we got caught," and not even directly from him or to the families, all while asking New Yorkers to trust your decisions. State Senator Asandra Biaggi also weighed in, saying in a tweet, "You're only sorry that you all got caught. Because of your decisions, thousands of people died who did not have to die. We're not offended, Melissa. We're furious, with extremely good reason." State Senator Andrew Gornades, Democrat, Bay Ridge, called it a betrayal of public trust. There needs to be full accountability for what happened, and the legislature needs to reconsider its broad grant of emergency powers to the governor. So you're starting to finally see that this is actually going to take hold. And may I humbly add to that, the thousands died who did not have to die, but and thousands also died in a horrible, lonely manner, because not only did these thousands of elderly people die in old folks' homes, but people were prevented from going and seeing their family members. These people died alone, with minimal human contact, period, in their end days, more or less, from their family members. Isn't it funny? I say this a lot in my personal life. I don't think I've ever said it on my channel before, but isn't it just funny how the CV worked out to be an 1800s eugenicist's dream, right? Everything that those sick bastards were trying to accomplish with eugenics in the early to mid 1900s, the CV is geared directly towards it. Isn't that weird? So I just read you all of that story, right? And then they put here what Governor Cuomo's response to this whole situation has been. So just listen to this. This is his response to this.
A third of all deaths in this nation are from nursing homes. New York State, we're only about 28% only. But we're below the national average in number of deaths in nursing homes. But who cares? 33, 28, died in a hospital, died in a nursing home. They died.
Sound familiar? Sound familiar, anybody? Class?
What was going on and why they were doing what they were doing?
No. We were misled that there were supposedly protests and then something sprang out of that, and assault sprang out of that. And that was easily ascertained that was not the fact. And the American people could have known that within days, and they didn't know that.
With all due respect, the fact is we had 4 dead Americans. Was it because of a protest, or was it because of guys out for a walk one night who decided they'd go kill some Americans? What difference at this point does it make? It is our job to figure out what happened. And
this, at what point what difference does this make? This is a way to classically, for the government to offload guilt. And it's usually around its citizens' death. How can we say, well, we're not responsible for these citizens' deaths? One of the main ways they do that is saying, well, don't look at why it happened. It happened, and that's all that matters. Because if you look at why it happened, you would see that the government was the cause. So when there's a causal relationship between citizens' deaths and the actions of the government, then all of a sudden, at what point, what difference does this make, right? Okay. So like I said, a lot of people didn't see this video that I'm about to play, and I'm only going to play a small part of it. I'm not playing the entire thing again, right? Nobody wants to watch reruns, but I want you guys to notice, and I'll link this video in the description along with all the other stuff, or in the below the pinned comment. But what I wanted to show was that this is the video that I ran 7 months ago. And in this video, I'm going to show you, number one, proof positive that Cuomo his office ordered the CV patients in there. Number two, I'm going to show you that Cuomo had plenty of spare beds to put people in because he never even used the federal resources that were sent to New York City. And then number three, I'm going to show you that there was a CDC report out on what had happened at the nursing home in Washington State before their orders to move CV patients into the nursing homes. And we'll read the pertinent part, underlined. No resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of CV. Nursing homes are prohibited from requiring a hospital resident who is determined medically stable to be tested for CV prior to admission or readmission. So let's get this straight. Not only was he forcing them to take the CV patients in, but the nursing homes themselves were prohibited from even testing them. Now that's on March 25th, and one would think the governor would know what the policy was. He definitely knew nursing homes were a problem.
504 in hospitals, 36 in nursing homes. Nursing homes are the single biggest fear in all of this. Vulnerable people in one place. It is the feeding frenzy for this virus. Despite everything we can do and the best efforts of people who are working in those nursing homes who are doing just a fantastic job.
Despite everything they could do. So understand, when you just looked at those numbers he just put up on April 18th, they were lying about those numbers. They knew they were lying about them and intentionally hiding them. And he's saying out of his mouth, despite my best efforts, we're still seeing how nursing homes are a danger. And Mr. Cuomo is certainly correct in what he said just then. The problem being the long-term care facility in King County, Washington State. Because the CDC had already done a comprehensive study on that original infection in the U.S. and released these results on March 18, 2020. And as always, guys, I will link you up in the description. But the important part of this report is right here, released March 18th. These findings demonstrate that outbreaks of CV in long-term care facilities have a critical impact on vulnerable older adults. It then goes on to lay out what a state should do in order to protect their target population. And all this is fine and dandy. The reports are great, but the problem that's really not letting Mr. Cuomo off the hook is common sense. Everyone with even an ounce of common sense knows that the first thing that they should do in regards to long-term care facilities is prevent CV patients from getting into the facility. And they did that according to visitors, according to workers. They had PPE. They did everything that they could do, except they allowed CV patients to be moved in. Now, all this considered, a few days later at his next briefing, Cuomo tries to act like he has no idea what's going on with nursing homes.
Positive for the virus, are you allowed to be admitted to a nursing home is the question. Or readmitted? Yeah. It's a good question. I don't know.
The policy is that if you are positive, you should be admitted back to a nursing home. The necessary precautions will be taken to protect the other residents there.
Now we can sit here and pretend with Mr. Cuomo that he didn't know, and we'll say we didn't know. Nobody knew. But the problem is, around the same time, Governor Cuomo was writing into the state legislation protections for the nursing home community. Because you got to remember, they're donors too, and they need protection. If you're going to start sending us CV patients and not giving us guidance, the least you could do is give us some legal protections. And he did. Now, we were told the reason why all this was going down was because we absolutely needed the hospital beds. We were terrified of overflow from all these CV patients. Except when the USS Comfort left, it left having had treated fewer than 200 patients. And the field hospitals that the Army built, they went largely unused. The overflow problems that we anticipated based off of that horrid model just never materialized. So the policy being for overflow reasons just doesn't match up for me. I found a recording from April 23rd. They don't have this one on video. And Cuomo talks about the whole situation, and I think you could pick out what the problem is.
Nursing homes, they are our top priority. They have been from day one. Remember how the nursing home system works. They are private facilities. They get paid to provide a service. They get regulated by the state government. There are certain rules and regulations that they must follow, and we put in additional rules and regulations on nursing homes in the midst of this crisis. Staff must have appropriate PPE. They must have their temperatures checked before they come into the facility. There are no visitors who are coming into the facility, which is a tremendous hardship, but it's necessary to protect public health. If they have a COVID positive person in the facility, that person has to be in quarantine. They have to have separate staff for the COVID residents versus the non-COVID residents. If they can't care for the person in the facility, they have to transfer the person to another facility. The nursing home is responsible for providing appropriate care. If they cannot provide that care, then they have to transfer the person to another facility. They have to notify residents and family members within 24 hours if any resident tests positive for COVID, or if any resident suffers a COVID-related death. That is a regulation that they have to follow. And they have to readmit COVID-positive residents, but only if they have the ability to provide the adequate level of care under Department of Health and CDC guidelines. If they do not have the ability to provide the appropriate level of care, then they have to transfer that patient. Or they call the Department of Health, and the Department of Health will transfer that patient, right? But that is how the relationship works. The state has very strict guidelines on privately run facilities. They get paid to take care of a resident. That resident, that patient must have a state-directed level of care. If they cannot provide that, they can't have the resident in their facility, period. Those are the rules. We're going to undertake an investigation of nursing homes now to make sure they're following the rules. It's going to be a joint Department of Health and Attorney General investigation. But those are the rules. They get paid to take care of a resident, and they have to do it in accordance with state rules. And if they don't, we will take appropriate action. And the State Department of Health and the Attorney General are going to be commencing an investigation to make sure all those policies are in place and being followed. If they're not being followed, they can be subjected to a fine or they can lose their license. It's that simple.
You hear that? It's just that simple. So what did you hear in that? I'll tell you what I heard. It goes a little bit like this. The state of New York subsidizes nursing home patients. And if that nursing home patient is in the hospital being cared for and the nursing home is still receiving that state money, well, New York State can't have that. They're paying the nursing home already to take care of this person. So if they can't take care of that person, then they need to transfer that person to another nursing home, which is also being subsidized by the state government. Understand, this is about keeping money separated. It was all fiscal. I mean, just think about that. They're denying people the right to visit their loved ones.
based off of a possibility that they might be infected. And yet, at the same time, they are intentionally loading CV patients into the place through the back door. The whole thing truly is disgusting. But by May 20th, Cuomo had his story together. And who's he going to blame?
This is a political season. I get it. I have refrained from politics. I'm not going to get into the political back and forth. But anyone who wants to ask why did the state do that with COVID patients in nursing home, it's because the state followed President Trump's CDC guidance. So they should ask President Trump. I think that will stop the
conversation. Are you fudging numbers? Because that's an accusation that you're facing, that you are changing the numbers to make...
Well, let's go back. Let's do one at a time.
Okay.
Your first point, why did the state do that? Because the state followed President Trump's CDC.
Wrong. The CDC had already released its determination about the Washington state nursing homes and had already released guidance to keep CV away from nursing homes under any circumstances. And now, this is recording done on May 20th. I did this video 7 months ago, and now we can look back when this reporter here asked him, "Are you fudging the numbers?" And we can see just exactly what he said.
CDC's guidance. Okay, that's that answer. No numbers were changed.
When it comes to the whole nursing home situation, I'm not going to get into the political back and forth and play politics. I was following Trump. And I tell you, I try to stay away from these fact checkers, but when you get somebody on the other side of the aisle getting a mostly false rating, you best believe it's false. That means it has not a shred of truth to it. Mostly false is about the worst they'll ever hit this guy with. And it wasn't just PolitiFact. The Medicare chief came out and said that Cuomo's nursing home order did not follow federal guidelines in any way, shape, or form. And then the next thing that people say to me whenever I'm trying to talk to people about this situation is that, oh, well, it never happened. That was the policy, but no patients were moved in. Absolutely untrue. The AP has counted over 4,500 patients that were sent into nursing homes just in New York State. Imagine.
And remember now, this video I'm making, this is right in the middle of them hiding it by as much as 56%. And what did Cuomo said? There were no hiding numbers. But you underreported them by 56%. We now have proof of that. At the time I made this video, I didn't have proof of that.
And so again, like in so many circumstances, we see somebody on the other side of the aisle being praised even though they've made blatantly poor choices. And I mean, people were floating this guy's name for the possible presidential nominee. Knowing everything we know now, I want you to watch this interview.
Governor, House Republicans are looking into New York's March 25th order that directed nursing homes to take in infected patients. This thing is not going away, sir. 6,300 people died in New York nursing homes. That is the most in this country. The more time has passed, the more your office has been able to look into this. Do you take responsibility for that order and the role it may have played in those deaths?
Yeah, the Republicans, Stephanie, are playing politics. They don't want to talk about how they are now handling this COVID virus. Yes, I understand that. And there are facts also, Stephanie. So let's look at the facts, right, rather than the political rhetoric. Yes, we had more people die in nursing homes than anywhere else because we had more people die. Because the federal government missed the boat and never told us that this virus was coming from Europe and not from China. And January, February, March, before they did the European travel ban, 3 million people came from Europe and brought the virus to New York. And the federal government did.
So Cuomo's supposition is that he had no idea there was a European CV strain, even though anybody who watches this YouTube channel knew that way before then. And you notice he's changed his claim a little bit, because remember, prior to this, he said, well, we followed federal CDC guidelines. That got shredded. And so now it's, oh, well, they didn't do the European travel ban fast enough, and we didn't know there was a European strain. Get the out of here.
And the federal government and the CDC and all of them failed to handle this pandemic and warn this nation. So New York had more cases, more deaths, and more deaths in nursing home because that's who the virus affects. It affects senior citizens. We know that. You look at any state, and they had a tremendous number of deaths in nursing homes. It's all a political charade, and it's an ugly one, frankly, to talk about a number of deaths and suggest.
Now look at that. New York, California, New Jersey, Illinois, and Texas. These are at the time, these are the states with the most cases. But understand that at this time and forever, there's only been a small list of states that ever made that order of moving CV patients into nursing homes. I'll go through it in another episode because I don't have the states for certain. But when I read to you the New York Post article and his lieutenant governor, or excuse me, the secretary to the governor was saying that Trump was tweeting about it, Trump was accusing Michigan, New Jersey, New York, California, basically all the same states that had a problem counting the 2020 election. A little strange, right? Same states, same states. I find that interesting.
There was politics at it. The number of deaths are still going up, Stephanie. Look at Florida, look at Texas, look at Arizona. Let them look in the mirror and say, you know what, we were wrong. We're killing people unnecessarily by this irresponsible, reckless reopening, and it's not working for the economy either. Those are the facts, Stephanie. There's still facts and truth in life, even in this.
So at the time of this recording, he's trying to blame the reopening for the reason why so many people had perished from this. And remember, right during this recording, he was hiding 56% of the fatalities that happened in nursing homes. The lies that he tells in this interview are astounding, knowing now what we know. Of course, we all knew then, but knowing now for sure, these interviews are disgusting. Those people's parents died a lonely, miserable death. And the only thing he has to give those families is, I didn't do it because Trump. This is disgusting.
Political mayhem that this nation is in.
Sometimes I look at these interviews and I think to myself, man, did I used to believe that shit? I don't know. It's a possibility. But what just happened there? She asked him a straight-up question, are you interested in taking responsibility for that order? And what did he do? Blamed other people for playing politics, diverted the attention to other issues, and then used fear of a future reopening wave to obfuscate the question that he never answered. And so there you go, folks. Andrew Cuomo's decision to move CV patients into nursing homes. Everyone's fault but his.
So as this story progresses, as we start to see the truth come to light, and as it starts to get really kind of sad, as we find out what's been going on inside of nursing homes in certain states across our country, it's important to keep in mind, for all of us to keep in mind, that this decision to move CV patients into nursing homes, it wasn't negligence. It wasn't because they're stupid. It was done with intent. Like, share, sub the channel, guys. I got a lot of more content coming. Love y'all.